I have seen a human being go from perfect health to complete neurological catastrophe in the span of seconds. I have stood in operating rooms and watched the brain die because blood flow was cut off. And I have spent 40 years trying to understand why some strokes come without warning and why others, if you know how to read the body, announce themselves days in advance. What I am about to tell you will sound strange to you, but I want you to listen carefully, because what I am about to share could save your life or the life of someone you love. 800 years ago, there existed a body of knowledge among certain Jewish scholars and physicians. These were men who combined rigorous observation of the human body with what they called Kabbalah, literally, that which is received, a system of understanding the hidden patterns that govern physical and spiritual reality. They were not mystics in the modern sense. They were physicians and philosophers who looked at the body and asked, what is the body trying to tell us before it breaks? What are the signs that precede catastrophe? And what they discovered, through centuries of careful observation, was a system of 7 body signs that appear 72 hours, sometimes more, sometimes less, before a stroke occurs. Now, I need to tell you something immediately. Modern neurology has no systematic framework for predicting strokes. We have risk factors: high blood pressure, high cholesterol, atrial fibrillation, diabetes, smoking, and these are important. But they tell us who is at risk in general. They do not tell us when a stroke is about to happen. A person can have perfect risk factors and still have a stroke. A person can have terrible risk factors and never have one. But the body knows. The body has signals. And if you know how to read those signals, you can often see a stroke coming. Let me tell you what the ancient Kabbalistic physicians identified. These 7 signs. I am not claiming they are mystical. I am claiming they are physiological. They are the body's way of communicating that the vascular system is becoming unstable, that blood flow is becoming compromised, that a cascade is beginning that, if not interrupted, will result in a stroke. The first sign is what I call facial asymmetry of expression. Not a full drooping of the face, that would indicate a stroke is already happening, but a subtle asymmetry. One corner of the mouth slightly lower than the other, one eye slightly less open than the other, a faint drooping at one corner of the mouth that resolves within minutes but reappears periodically. This is a sign that the blood supply to the facial nerve, the 7th cranial nerve, is becoming unstable. The ancient physicians called this the smile of warning. What is happening is that small blood vessels in the face are becoming compromised. Not enough to cause permanent damage, but enough to cause temporary loss of function. This is a warning. This is the body saying, circulation is becoming unstable. The second sign is a sudden change in taste. Not a loss of taste, but a change. A metallic taste, a bitter taste, a taste that was not there before, a taste that comes and goes. This is significant because the nerves that control taste, primarily the facial nerve and the glossopharyngeal nerve, are supplied by very small blood vessels that are exquisitely sensitive to changes in blood pressure and blood flow. When these vessels become unstable, one of the first signs is a change in taste. The ancient physicians understood this. They documented it, and they taught their students to always ask a patient, "Have you noticed any change in how food tastes?" Because the answer to that question can be diagnostic. The third sign is sudden difficulty with balance. Not vertigo, not the room spinning, but a subtle feeling that your equilibrium is off. A tendency to drift slightly to one side when you walk. A feeling that you need to concentrate on your balance in a way you did not before. This is a sign that the blood supply to the cerebellum, the part of the brain that controls balance and coordination, is becoming compromised. And the cerebellum is supplied by blood vessels called the vertebral arteries. These arteries are particularly vulnerable to blood clots and to dissection, small tears in the arterial wall. When blood flow through these arteries becomes unstable, balance is one of the first functions to be affected. The fourth sign is a sudden change in vision. Again, not blindness, but a change. Blurred vision that comes and goes. A shadow in one corner of the visual field that appears and disappears. Double vision that is intermittent. Difficulty focusing that was not present before. These are signs that the blood supply to the visual cortex at the back of the brain is becoming unstable, or signs that the blood supply to the cranial nerves that control eye movement is being compromised. The ancient physicians understood that the eyes are windows into vascular function. They taught that sudden changes in vision, even subtle ones, demand immediate investigation. The fifth sign is sudden changes in hearing, a ringing in the ears that was not there before, or conversely, a sudden muffling of sound, a feeling that one ear is not hearing as well as the other. This is a sign that the blood supply to the inner ear, which is supplied by the anterior inferior cerebellar artery, a vessel that is particularly vulnerable to stroke, is becoming compromised. Hearing is exquisitely sensitive to blood flow. When blood flow to the inner ear becomes unstable, one of the first signs is a sudden change in hearing. The sixth sign is sudden difficulty with coordination of fine movements, a tremor in the hands that was not there before, difficulty writing or buttoning buttons, a clumsiness that is new, dropping objects that you normally would not drop. This is a sign that the blood supply to the cerebellum and to the motor cortex is becoming unstable, and it is important to distinguish this from arthritis or other causes of clumsiness that develop slowly. What we are looking for is sudden, a change that occurs over hours or days, not weeks or months. The seventh sign is perhaps the most subtle and the most important. It is a sudden change in mood or in cognitive function, a sudden irritability that is uncharacteristic, a sudden difficulty concentrating, a sudden feeling of confusion or disorientation that is brief but noticeable, a sudden difficulty finding words. This is a sign that the blood supply to the frontal lobe or the temporal lobe, areas that control mood, impulse control, and language, is becoming compromised, and this sign is frequently missed because people attribute it to stress or fatigue. But the body knows. The body is signaling that something is wrong. Now, I need to tell you something crucial. If you experience any one of these signs, it does not necessarily mean you are about to have a stroke. These signs can be caused by other things: migraines, inner ear infections, anxiety, medication side effects. But if you experience multiple signs in a 72-hour period, or if you experience any of these signs repeatedly over days, you need medical evaluation. You need to be taken seriously, and you need to advocate for yourself, because many emergency room doctors will not understand the significance of these early warning signs. I remember a patient named Margaret, 83 years old, from Manchester. She came to see me complaining of something subtle. She said, "Doctor, I cannot quite explain it, but something feels different. My mouth tastes metallic. I feel slightly off balance. And I had a moment yesterday where I could not find the word for something simple. It frightened me." I listened to her, and I took her seriously. Most doctors would have done some basic blood work and sent her home, but I knew what to listen for. These were the early signs. I sent her to the hospital for advanced imaging, and they found it, a small blood clot forming in one of the arteries leading to her brain. She was started on anticoagulation therapy immediately, and she never had a stroke. The ancient Kabbalistic physicians understood something that modern medicine has largely forgotten. They understood that the body does not fail suddenly. It gives warnings. It sends signals. And if you know how to read those signals, you can intervene before catastrophe. The problem is that modern medicine is trained to look for big, obvious signs: a full facial drooping, complete vision loss, severe slurred speech. These are signs that a stroke is actively happening. But the early signs, the subtle signs that appear 72 hours before, these are overlooked, because they are not dramatic, because they can be attributed to other causes, because they require careful listening and observation. But here is what I learned in 40 years of practice. The patients who survived strokes best, the patients who recovered most completely, were almost always the ones who had recognized an early warning sign and sought immediate medical attention, not the ones who waited until they were in the middle of a catastrophic event, but the ones who felt something was off, who trusted their intuition, who got evaluated, and who were able to receive treatment that prevented the catastrophe from happening. Now, I want to tell you about the mechanism. Why do these 7 signs appear before a stroke? What is actually happening in the body that causes these specific signs? The answer involves understanding blood clot formation and cerebral circulation. A stroke is usually caused by one of 2 things: either a blood clot that travels to the brain and blocks an artery, or a rupture of an artery in the brain. Most strokes are the first type, ischemic strokes caused by blood clots. And blood clots do not form suddenly out of nowhere. They form through a process that takes time. It begins with inflammation in a blood vessel. It continues with platelet aggregation, platelets beginning to stick together. It progresses to fibrin formation, the creation of a protein network that traps blood cells, and eventually a clot forms. During this process, as the clot is forming and growing, the blood vessel is becoming increasingly compromised. Blood flow through that vessel is becoming turbulent and unstable. And this instability causes predictable symptoms based on what part of the brain that vessel supplies. The facial nerve is supplied by very small vessels, so facial asymmetry appears early. The taste nerves are supplied by small vessels, so taste changes appear early. The balance centers in the cerebellum are supplied by vulnerable vessels, so balance changes appear early, and so on. The ancient physicians understood this through observation. They did not have the language of neuroscience, but they had centuries of clinical observation. They had documented which signs came before strokes, and they had taught their students to recognize these patterns. This knowledge was preserved in certain Kabbalistic texts that discussed medicine alongside philosophy, and it was largely lost to Western medicine because Western medicine decided that only what could be measured chemically or mechanically was worth paying attention to. But times are changing. Modern research is beginning to validate these ancient observations. A study published in the journal Stroke in 2018 examined pre-stroke symptoms in patients who had experienced strokes. The researchers found that 37% of stroke patients reported subtle neurological symptoms in the 72 hours preceding their stroke. And the patients who recognized these symptoms and sought medical attention early had significantly better outcomes than those who did not. The most commonly reported early symptoms were exactly what the ancient physicians had identified: balance changes, vision changes, facial asymmetry, taste changes, and cognitive changes. I want to tell you something important. If you or someone you love experiences any of these 7 signs, the appropriate response is not panic. Panic clouds judgment. The appropriate response is careful attention and medical evaluation. Here is what you should do. First, note exactly what you are experiencing. Write it down. When did it start? How long does it last? Does it go away? Does it come back? Is it getting worse? Second, seek medical evaluation, not necessarily emergency evaluation if the symptoms are very subtle and intermittent, but evaluation. Tell a doctor what you are experiencing. Be specific. Do not minimize it. Do not assume it is stress or aging. Third, if you have risk factors for stroke, high blood pressure, diabetes, atrial fibrillation, a history of blood clots, a family history of stroke, take these early warning signs seriously. You are at higher risk. Fourth, if the symptoms are severe or if multiple systems are affected simultaneously, call emergency services. Get to a hospital. Get imaging. Get evaluated by a neurologist if possible. Now, I want to tell you about prevention, because while recognizing early warning signs can save your life, preventing a stroke in the first place is obviously preferable. And here, the ancient wisdom and modern science converge completely. The things that prevent blood clots from forming are the things that keep blood vessel walls healthy. And what keeps blood vessel walls healthy? First, adequate blood flow, which means regular movement, not intense exercise, but consistent, gentle movement. A walk every day, a swim, yoga, tai chi, anything that keeps your blood moving. Stationary bodies develop stagnant blood and stagnant blood clots. Second, proper hydration. Your blood needs to be the right viscosity, the right thickness. If you are chronically dehydrated, your blood becomes thick and sluggish. It clots more easily. This is one reason that elderly people, who often do not drink enough water, have higher stroke risk. Third, proper nutrition. Specifically, foods that support vascular health. Fatty fish with omega-3 fatty acids, leafy green vegetables with vitamin K and magnesium, berries with antioxidants, garlic and onions with compounds that inhibit platelet aggregation. These are not supplements. These are foods. They are available in any grocery store, and they work. Fourth, stress management. Chronic stress elevates cortisol. Elevated cortisol increases inflammation. Inflammation damages blood vessel walls. This is why the practice of Sabbath rest, which I have discussed before, is so important. It is not just about blood pressure. It is about vascular health at the cellular level. Fifth, sleep. During sleep, your body performs repair and maintenance. Your blood vessels are cleaned of inflammatory particles. Your endothelium, the inner lining of your blood vessels, is restored. If you chronically do not sleep enough, your vascular health deteriorates rapidly. I had a patient, Samuel, 79 years old, from Toronto. He came to me with atrial fibrillation, an irregular heartbeat that significantly increases stroke risk. He was appropriate for anticoagulation therapy, but he was also experiencing 4 of the 7 warning signs: intermittent balance changes, periodic blurred vision, occasional taste changes, and brief moments of difficulty concentrating. I did the appropriate imaging, and we found evidence of small microemboli, tiny blood clots, that had not yet caused a stroke but were circulating in his brain. He required aggressive anticoagulation, but he also needed to understand what was happening. So I explained to him the 7 signs, and I told him that if he experienced any of them becoming more frequent or more severe, he needed immediate evaluation. We also addressed his lifestyle. He was sedentary. He was not sleeping well. He was dehydrated. He was eating poorly. We made changes. He started walking 30 minutes a day. We worked with a sleep specialist to improve his sleep quality. He increased his water intake. He changed his diet to emphasize vascular health. Within months, the microemboli had resolved. His intermittent symptoms had disappeared, and his stroke risk had dropped dramatically. The ancient Kabbalists understood something that we have lost. They understood that the body is not separate from the mind, and that both are expressions of deeper patterns. They understood that illness does not appear suddenly. It announces itself. It gives warnings, and they taught their students to listen to those warnings, to pay attention, to take the body seriously. I have written down everything I have learned about these 7 warning signs, the exact descriptions of each sign, how to distinguish them from other conditions, what medical evaluations to request if you are experiencing them, how to explain them to your doctor in ways that will be taken seriously, and the complete prevention protocol in a detailed guide. The link is in the description below. It contains information that could save your life or save the life of someone you love. But whether you get that guide or not, I want you to understand something today. Your body is speaking to you right now, all the time. It is telling you what it needs. It is warning you of danger. And if you learn to listen, if you learn to pay attention to the subtle signs, you will have the most powerful medical tool available, early warning. You will know when something is wrong before catastrophe strikes, and you will have time to act. The Talmud teaches that the greatest physician is not the one who treats disease, but the one who teaches people to listen to their own bodies, the one who empowers people to recognize their own signs and symptoms, the one who says, "You are not helpless, you are not passive, you are not a victim of your own physiology, you are the most important diagnostic tool you possess, your awareness, your intuition, your willingness to take yourself seriously, and that awareness, that intuition, that self-knowledge could save your life, not someday, but today. In the next 72 hours, if you experience any of the 7 signs, trust yourself, get evaluated. Do not minimize what you are experiencing. Your body is trying to tell you something, and you need to listen.